little bit more about Dr. Mary and introduce her. So Dr. Mary has a combined 20 years of experience in research, education, and consulting. She has her PhD in molecular biology, biochemistry, and genetics. Woo, PhD queen, from the University of Cambridge. And she pivoted from biomedical research to integrative health about 8 years ago. Dr. Mary helps people to understand their bodies and optimize their health, and educate and empowers and advocates for their place in the medical system so they can live long, healthy lives. So, such a privilege to have you here, Dr. Mary, and speak to us on this topic. So without further ado, I'm going to hand it over to Dr. Mary for her presentations on women's health, hormones, and the health span. Enjoy.
Thank you, AJ. Thank you, friends, for being here. New and old, really appreciate you taking time and your precious energy to listen to what I have to say. It's my honor and privilege to talk to you about this. It's one of my truly favorite things to talk about, which might sound weird, but we'll figure out why soon. It's quite a fascinating topic, and I really hope you get a lot out of this discussion today. So I'm going to share my screen here. Okay, great. So let's dive in. The topics I'll be talking about today are the hormone changes you may experience in midlife. How do I know my hormones are changing? The current state of affairs in women's hormonal health care. And easing the midlife transition, natural ways you can support your hormones. So you might want to take some notes. We will have a recording available after. I just saw that question in the chat. And I'll leave you with 3 practical takeaways at the end to sort of help everything land. And before we start, I just want to say, if you're really in the dark on this topic, that is totally normal. Most people are, even doctors, and we'll get to why that is later. So let's start with hormone changes in midlife. The what, the when, and the why of perimenopause. Before we dive in, I wanted to actually just define some terms so we can get really clear, because a lot of the time, perimenopause gets lumped in with menopause. It's confusing, but they're different. And for the typical woman, perimenopause is the 6 to 10 year transition period before menopause. It's kind of like puberty in reverse. A woman's hormones will fluctuate wildly, and it typically starts in the late 30s into the early 40s, but it can start as young as 30 or as late as the 50s or even into the early 60s. Menopause is actually defined as the day she has had no period for 12 months at an appropriate age. So it's a moment in time, actually. And the average age in North America is 51. Postmenopause is from month 13 onward for the rest of her life. Okay, right. So what actually is perimenopause? Perimenopause starts happening when her sex hormones start to change. This is the menstrual cycle, and a few of the key hormone players are at the top here. So you can see that from day 1 to day 28 of her cycle, her hormone levels rise and fall in order to orchestrate some truly incredible corresponding changes in her body, illustrated in the middle bits here. We get the maturation and release of the egg, and the shedding and growing of the endometrium, or inner lining of the uterus. This is menstruation right here. So in perimenopause, the first hormone to start declining is progesterone in green here, which you can see is the highest during the luteal phase compared to the other hormones, namely estrogen in pink. And I'm telling you this because this ratio is so very important. When the ratio of her progesterone to estrogen drops, everything changes. This is what's called estrogen dominance, and it's most common in women over the age of 40. It means she'll experience both changes in her cycle as well as mental and physical symptoms, which we'll get to in a minute here. Unfortunately, her progesterone doesn't fall steadily. It actually is all over the map from month to month. So her symptoms aren't predictable each month, which can make her feel a little bit crazy. And to illustrate this point a little better, this diagram shows how progesterone in green and estrogen in red, how those levels can change over the course of her life. For simplicity, this diagram just shows a few sample months from each stage of her life. So each progesterone peak here represents a typical month of her cycle. And you can see that during puberty, her progesterone in green ramps up and then cycles up and down pretty consistently with every menstrual cycle until she reaches perimenopause. Then it starts to become erratic and eventually drops to prepubescent levels. And her estriol, or estradiol, in red, also ramps up through puberty. And it cycles steadily until perimenopause as well. Then it can be all over the place until it eventually tapers off as well, usually long after progesterone falls. So you can really see here the estrogen dominance pattern and why perimenopause is like puberty in reverse. So that's all fine and well, but let's now talk about the symptoms that these changes right here in perimenopause can produce. So next, how do I know my hormones are changing? Hint, it can be surprising and confusing. So the ways to know you might be in perimenopause, and I want you to understand first why it can be surprising and confusing, aside the fact that progesterone is all over the place. Firstly, every woman is different in terms of her timing, her symptoms, and the support she needs. Secondly, about 75% of women experience unexpected, yet very common physical and emotional symptoms. A lot of these symptoms happen long before she skips a period, which is why women and their doctors actually don't necessarily associate with these symptoms with perimenopause. Thirdly, there are a lot of uncommon symptoms. So let's start off with the most common symptoms first. Among the first signs of perimenopause are shifts in her cycle. It will typically get shorter, from 28 to 25 or 26 days, and her periods will often be lighter as well, but not always. In terms of mental and physical symptoms, most women think the first sign will be hot flashes. Yeah, well, that actually, it's on the list, but there are actually others that are way more common. And so I'm going to show you the top 10 symptoms, which might surprise you. And this is according to a very recent paper published this year from the Morphus group in the States, which surveyed over 3,000 women. One of the most comprehensive studies we have to date. So here they are, top 10: fatigue or lack of energy, brain fog, sleep issues, memory loss and forgetfulness, anxiety, joint pain, lack of concentration, lack of focus, hot flashes, and loss of or low libido. Wow, right? Notice that most of these symptoms are actually psychological. And looking at this list, you can see how it would be easy to misdiagnose. Many of them look similar to other health conditions like thyroid problems, depression, and anxiety, or maybe just are signs of chronic stress rather than signs of hormonal changes, especially when you look at what women are doing in their early 40s. They're busy with work, children, aging parents, like a lot of very real demands. So it's easy for women to think that they're actually just losing their minds. But most of these symptoms, given that most of these symptoms are psychological, and it can be scary, especially because most doctors don't associate these symptoms at all with perimenopause. So those are just the top 10 out of 34 commonly recognized symptoms. And by commonly, I mean among like functional medicine, functional health providers, naturopaths, people outside of the conventional medical paradigm. They tend to know more about this stuff. So actually, there's 34 commonly recognized ones, but in that paper they identified over 100, and some of them are pretty wild. So I just wanted to show you briefly to give you an idea. You might not be able to read this, that's fine, I don't expect you to. These are symptoms 11 out of 47, still only half of them. And I'll just point out a few odd ones, just so you're aware. You might want to actually go to this paper and we can send it to you after the talk if you want to see it. They are itchy ears, social anxiety, tingling extremities, shoulder pain. We have clumsiness, inflammation, vertigo, tinnitus, body odor, increased hunger, hard bloated stomach, brittle nails, unwanted hair growth, and so on. So if you want to see the paper, just reach out to us. There's 50 more symptoms on this list. So anyway, okay, why are so many of these symptoms psychological? In part because the role of progesterone, which you'll recall is the first hormone to decline in perimenopause, it is very calming to the brain, progesterone and its metabolites. If progesterone is low, we get sleep problems, anxiety, we're more irritable, less patient, less calm, etc. So that's kind of the why there. I hope that all is clear. And I should zoom out for a second and say, this might all sound like doom and gloom, but I want you to know something really very important. These symptoms are largely preventable. Women should not be suffering as much as we still do. So I want to move on and talk about why this is and what you can do. So here we have this current state of affairs in women's hormonal healthcare. What to expect and how to empower yourself when you go to the doctor. So I will say the standard of care is abysmal because there isn't one, and it's not the fault of our doctors. There's actually been a shocking lack of scientific research on this topic and on women's health in general. Women have been systematically excluded from basic health research because our hormone cycles complicate the data. And actually, this is something I heard as a researcher all the time in my 15 years in the lab. Frustrating. I actually just wrote a blog on this if you want to know more. Anyway, this lack of research, it trickles down into our medical paradigm. So a lack of data means a lack of treatment protocols and a lack of patient support. Most doctors don't know about the array of symptoms or how to support hormones effectively at all, and it's not their fault. The training on perimenopause management is profoundly inadequate even nowadays, and physicians aren't adequately trained to provide the standard of care to women transitioning to menopause. But I will say, there's good news ahead. Change is actually happening. Recent funding and quite a lot of publicity by giants in science and medicine and the media is really helping. In fact, First Lady Jill Biden just announced $100 million in research funding to close the gap in women's health research. So that's great. Okay, so moving on. Regardless of the state of affairs, let's say you go to your doctor for help because you know your hormones are changing. You can probably expect one of two responses. Your weight gain, poor sleep, memory loss, moodiness, dryness, hair loss, depression, anxiety, impatience, intolerance to alcohol, etc. is just part of getting older. Boo! Boo this answer. It's not true. Don't buy it. The second possibility is, let's do some blood work and check your hormones. Then maybe we'll talk about hormone replacement. And the translation of this statement, I would say, is let's take a glance at the levels of just a few of your major hormones, but leave out some of the really key ones that can give us far more insight into what's going on for you under the hood mechanistically. Then we'll make a guess at what to do to address this very complex issue based on 4 or 5 markers. But we won't talk about natural ways you can support your hormones. We'll probably just give supplemental hormones, change nothing else, and hope for the best. Ugh. I'm sorry this sounds cynical. It's not your doctor's fault. As I said, it's a tragic systemic problem. Anyway, the blood work is a great start. Definitely you want to get blood work to start things off. So you do the blood work. Let's say you find out your hormones are low or out of balance. So the doctor writes you a prescription for supplemental hormones or hormone replacement therapy / HRT. Maybe. They may also wrongly tell you that HRT is dangerous and advise against it. And this is dead wrong for most women. I don't have time to go into why here, so we'll move along, but we'll get into HRT and the questions as a lot of you asked about it. that HRT prescription may or may not be what your body needs at all. You may feel better, you may feel nothing, or you may feel worse. If you feel worse, you'll probably swear off HRT forever and potentially do your mental and physical health a tremendous disservice. That is a sad face. If you somehow feel completely better the first time around, then hooray, you win. And you are somewhat in the minority. If, like most women, the supplemental hormones do improve some, but not all of your symptoms, you'll have to go back to your doctor after weeks or months because the hormones need some time to do their thing, to get them tested again. And so your doctor can adjust your prescription. And you might have to do this several times before you get it right. So you repeat the process, maybe a few times. Unfortunately, and there's an asterisk here, a lot of women do not know they need to do this. They don't revise their initial prescription, even though it doesn't really do the job. And they continue to suffer with symptoms, not realizing that they just need to keep trying. And why is that? Why doesn't the doctor get it right the first time? Well, there's no formula for balanced hormones. Every woman is different, and that's beautiful, and we need to be prepared for that. So there are two things you can do to smooth out this process, and you can do them soon. Both of them are about getting to know your hormone levels. When you know your baselines and you can see which hormones have changed, you can help support your doctor in deciding which hormones you may want to start with and where you want to go. See, there are 4 different sex hormones they may prescribe: progesterone, estrogen, testosterone, and DHEA. And your levels will look different from the girl next door. So you may also need to address your thyroid hormones, your cortisol, and or your insulin levels, depending on your situation. And that's where the blood work comes in. So how to do this? Getting to know your hormones through regular hormone testing from the age of 35, ideally, and ideally twice a year, is important. You want to understand the baseline before change starts to happen. And I know it's too late for this for most of our audience who are over 35, I would imagine, and that is totally okay. Just get these tests done as soon as you can and keep getting tested regularly as you cruise through perimenopause into menopause. That's important. The second thing is to get a more comprehensive hormone panel done, like the Dutch Complete test. Now, this is generally only administered by functional medicine providers and naturopaths. MDs don't deal with them. Some of them don't even know about the Dutch test or comprehensive urine hormone testing, which is what it is. You do it at home with the kit. You can buy one directly yourself from the company, which is called Precision Analytical, or Maka Health can help you procure one as well. So this test is important because it measures all of the relevant hormones plus their breakdown products or metabolites, which are very important to how you feel. Plus, it measures a variety of vitamins needed to support your hormone production. It looks at how your adrenals are functioning and a lot more. I don't have time to go into it too much here, so just please talk to your provider or your Maka guide if you're interested. Now, before we move on, a quick note on how to get the most out of your tests so you're not wasting any money and getting false results. So always test on the same day of your cycle. Ideally, day 21 to 23 if you still cycle. Don't test during ovulation. Lots of things will go way up or look really wonky, including your thyroid. If you're testing your thyroid, avoid vitamin B2 or riboflavin supplements for 48 hours before. It's a good idea to test the thyroid. Your doctor should know this and do that. And before your test, eat well, don't exercise vigorously, and avoid intense stress for 48 hours before testing. Don't drink alcohol for 24 hours and avoid smoking within 15 minutes. Okay, so moving on to our last and most important section, easing the midlife transition, natural ways you can support your hormones. And this applies whether you are on hormone replacement or not. So you may have noticed when I spoke about what you can expect from a doctor, there was nothing at all about how to support your hormones naturally. And that's just not something that's part of the medical paradigm, but it's extremely important. The fact is that you can take all the supplemental hormones you want, but if you don't support your body with healthy habits, they won't help that much. Okay, so how do you do this? You should know first that hormone production starts actually in the brain. And then it relies on the mitochondria, the little bitty guys inside of every cell, billions of them, that produce your energy and respond to everything you're doing in your life. Both your brain and mitochondria have to be functioning well and not on high alert or sensing threat in order to tell the ovaries to produce healthy levels of hormones. And they're very sensitive. Your hormones are like your canaries in the coal mine. They're the first to react to stress, toxins, etc., and they're the last to heal. They're like drama queens. And actually, when they're off kilter, they're telling you there's something wrong by giving you symptoms like PMS or moods or cramps. And actually, the updated thinking on PMS is that it actually shouldn't be so normalized. It's the body saying it's not happy about something and asking you to do something else. So in perimenopause, we become more sensitive to stresses that throw off our hormones. So it becomes more important to support them by keeping our brains and bodies happy. So let's talk about that. Here are the top ways you can support your hormones at any age. I'm not going to go into much detail here, as we would keep you for hours. I'll just give you a few examples where it seems important. And if you have questions, please drop them in the chat or consult your Maka guide or specialist. Our role at Maka is to make sure you have all the tools you need to thrive in the ways I'm going to present to you now. First, start with your sleep and circadian rhythm. All important sleep. This is where we restore and our brain goes through its own detoxification process. While sleep might be a bit more of a struggle as we age, the more we can do to support it, the better. So you can really support your sleep by supporting what's called your circadian rhythm or your 24-hour body clock. You want to keep steady sleep-wake times. Don't eat too close to bed, have caffeine too close to bed. Avoid screens and bright lights at night. That's a huge one. And most people don't do that one. So on the other end of sleep, when you awake, don't immediately get on your phone. Get 5 to 10 minutes of natural full spectrum sunlight in your eyes within 30 minutes of waking. And ideally hold off on caffeine for 60 to 90 minutes and so on. There are so many ways that you can support your circadian rhythm. Those are just a few examples. And supporting your sleep directly, good what's called sleep hygiene is really helpful. So a cool, totally dark bedroom. I'm talking pitch black, or use an eye mask. No electronics or mentally stimulating activities within an hour of bedtime. That includes scary movies, stimulating media, that kind of thing. Having a wind down routine really helps. And there are just so many other ways to support your sleep. It's one of our foundational focus points at Maka, actually. Okay, let's move on to number 2, reduce stress. You've probably heard this one before and you're like, yeah. Stress, I'll reiterate, has a huge impact on our hormones. We obviously can't get rid of stress in our lives, but resiliency and learning to manage it is really important. So things that can help, number 1, ensure you're breathing properly through your nose into your abdomen with your diaphragm, not your mouth and not just your chest. Finding time daily to relax and do things you find calming, like cuddling someone or a pet, taking a bath, meditating, stretching, these calming things that shift you into a healing, so-called parasympathetic rest and digest mode, where you're actually making hormones, and out of flight or flight mode, which steals your hormone producing capacity. You can also stimulate the soothing vagus nerves that run from your brain to the bottom of your spine and contacts all of your organs. You can do that by singing, gargling water, or humming, anything at the back of the throat that sort of tickles that nerve. And of course, exercise is another great one for busting stress. It's also actually really important to you recognize things that stress you out that you can remove from your life or stop doing, like constantly being late, getting too hungry, overeating, putting too much on your to-do list, toxic people, all that kind of stuff. Okay, moving on to number 3, don't forget to play. Along the same lines, and this speaks to the importance of shifting into that parasympathetic relaxed state. Don't forget to experience joy every day, even in the smallest ways. As we get older and our jobs or family duties and our tasks, they become more dominating in our lives, we often forget how to play and have fun. So finding the joy and play in every day, by yourself or in community, even if for just a few minutes, is so important. Number 4, ditch the chemicals. So these so-called endocrine disrupting or hormone disrupting chemicals are in a lot of things we use daily. And they bind to your hormone receptors and activate or inactivate them when you don't want that to happen. So you want to ditch anything with artificial fragrances, perfumes, laundry, dish detergents, soaps, air fresheners, candles, not the nasty artificial chemical filled kind, please. Plastic containers and water bottles, canned food with BPA liners, microwaving anything in plastic. Most hair, skin, and nail care products that contain something called phthalates, look at the label. Bleached, scented feminine products are a no. And you want to consider organic foods, especially when it comes to something called the Dirty Dozen. You can check that out online. Just Google Dirty Dozen Clean 15 2024, and that will give you a list of produce to avoid or eat organic. Grains as well, organic only, meat and dairy ideally. I know that gets expensive, so you've got to sort of figure that out. It's tricky. You might also consider filtering your tap water or air, etc. There are many ways to reduce toxins in your life. Again, speak with your Maka guide or specialist to narrow down your sources of toxins, because everyone's different. You can also help your body to detoxify in a variety of ways, such as using a sauna or heat exposure, things that make you sweat, exercise, lymphatic massage, certain supplements, and there are other practices too. 5, move your body. Regular movement and exercise is so key for so many reasons. It boosts testosterone, actually, which gives you that your libido and your muscle building capacity. It's really important. It also boosts other feel-good hormones, among other things, like circulating the fluids that detoxify your body, your lymphatic system, and it sets you up for a good night's sleep. So actually, for some people, for a lot of people, it can be hard to know how much exercise is appropriate at what intensity, etc. So it can be a good idea to hire a trainer or a coach to start you off on a new routine if you feel like you need one, or like what you're doing just isn't getting you the results you want. Number 6, nourish yourself. When it comes to hormones, the food you eat matters so much. And this is another foundational pillar of how we can help you at Maka. If you're new to nutrition, it can be important to consult a professional so you feel confident instead of confused. There's really so much baloney out there. But I will say the most common issues I see with women, especially in perimenopause and menopause, are these. Too little protein, that's huge. Eating foods they know don't agree with them, which causes inflammation, or drinks. Dehydration and not using electrolytes and water regularly. Reliance on a carb-heavy diet that produces sugar highs and lows and messes with insulin long-term. And fasting the wrong way, which really messes with hormones. Women need different fasting protocols than men. And we have a question about this in the Q&A, so we'll come back to that. It's a good one. Number 7, supplements. Supplements can be really supportive, and I'm a big fan if well-sourced and personalized to you based on your lifestyle, your blood work, and ideally your genetics. So you can talk again with your healthcare professional or your Maka specialist about this. That said, I will offer you some of my favorites. 1, magnesium, amazing, at least 400 milligrams a day. Vitamin D and K2. Please test your vitamin D first. You probably need a lot more than you're taking. A B complex, omega-3s, and quality is important there as they often go rancid and won't be good for you. 5, vitamin E, 6, vitamin C, 7 would be zinc and copper, but these really need to be balanced, so please test them before supplementing. Know that if you've been on birth control, that can really mess with your copper levels. Important. 8, if you need them, adrenal stress supporting herbs like ashwagandha, rhodiola, or eleuthero, or liver supports like choline and milk thistle can be great. 9, some people also really benefit from certain probiotics and prebiotics. And finally, number 10, there are other herbal menopause supports like Maka, Donkai, red clover, and others, but I would emphasize the basics first and make sure you consult a professional before you start any new supplement. And finally, number 8, genetic considerations. Last but certainly not least, as a geneticist, I'll tell you that while we still have a lot to learn about how our genetics impact our health, we do know some very important genetic backgrounds that influence health, hormones, and longevity that you can completely influence through small but meaningful lifestyle adjustments. And that's something we also help you with the Maka program. Everyone has different combinations of genes, obviously. So when we run a genetic panel for you, we translate your data into actionable, personalized advice that can help you immensely with everything from hormones to the best diet and supplements for your unique body. For example, if you have a history of hormone difficulties, terrible periods or PMDD, heavy periods, fibroids, PCOS, those sorts of things, if you have breast cancer in your family, uterine cancer, we will look at the genetic pathways involved in your estrogen metabolism, and they will often tell us exactly what we need to do to reduce the levels of so-called toxic estrogens in your body, as well as other compounds, to balance your hormones and reduce your risk for age-related diseases. And regardless of your hormonal history, looking at these pathways is important for every woman when it comes to hormone replacement therapy in order to reduce any risks and to ensure the therapy will help you alleviate your symptoms, not make them worse. Okay, so that's it. I told you I'd leave you with 3 practical takeaways. So here they are. 1, please get to know your hormones. Test regularly via blood work and the occasional comprehensive test like the Dutch. Number 2, if you're having symptoms, talk to your doctor about them in the context of perimenopause, or talk to your Maka guide. Don't be afraid to let them know what you now know. Educate them. Help spread this conversation and start the movement. They may not take to it well, and they may. If they don't, maybe time to find a new doctor. Number 3, support your hormones naturally. Good sleep, less stress and toxins, more play, personalized nutrition and supplements, and consider your unique genetic factors. Okay, that's it. Thank you so much for listening. I appreciate your time. We'll move on to questions.
Amazing. Thank you so much, Dr. Mary. So fun. Such great information. I'm sure everyone here learned a little something new today. We are going to go through a little bit of the questions that you guys submitted through the registration link. And actually, a lot of them are related to HRT, which Dr. Mary touched on throughout her presentation. And one of the first questions was, please talk about HRT, which we did. Yeah, I hope we answered a few of those questions. When should someone consider HRT, Dr. Mary, and what are the risks and who should avoid it? I know you touched on a few, but are there any more specific things you would like to say to answer that question?
Yeah, absolutely. This is a fabulous question. I get it all the time. So let's, it's a deep topic. I'll do my best to really keep it concise, but I'm gonna go in a little bit because it's so important. And there's a lot of misinformation. So let's start with the first question. When should I consider HRT? The old idea was that, and many docs will still say this, is that you shouldn't start till you're post-menopausal. This is absolutely not true, and actually the wrong approach if you really want to preserve your health and avoid damage, and preserve your sanity if you have symptoms. you can, and it is best to start HRT well before menopause if your hormones are low, regardless of whether you're symptomatic. Test with blood work, as I said, and if you're falling low, it's best to replace and or support your hormones naturally. You don't necessarily want to wait until you have symptoms. Like, like anything that's off in your body, if something is going wrong, by the time you feel it, that's your body sort of crying out for help, which manifests as symptoms because things are starting to go wrong and damage is being done. If you do have symptoms, you want to explore first, maybe also whether you have lifestyle factors that are contributing to them and harming your hormone production, things your body doesn't like doing, the sort of 8 things I just rattled off. Then if you still have symptoms, you want to do some hormone testing and look at your levels with your doctor. Hopefully you've already done some testing so you know what your baselines were previously, but if you haven't, that is totally okay too. So in a nutshell, hormone therapy can be certainly very useful at all stages of perimenopause, from early to late. In the early stages, many women would benefit from a low dose of progesterone for disrupted sleep, anxiety, moods, fatigue, and that stuff, etc. I'm just starting this journey myself at 43, just picked up my prescription. I'm stoked to get my sleep on track. That was definitely the first thing for me. Some women will want a little bit of estrogen a little bit earlier on too, depending on their levels and symptoms. So as we progress deeper into menopause towards perimenopause towards menopause, adding estrogen and sometimes testosterone and or DHEA is also important. So I wanted to mention here as well that there are a few more specific intense symptoms or situations that even conventional doctors will recognize as use cases for starting hormone replacement. They are significant hot flashes and night sweats, vaginal symptoms such as dryness, itching, or painful sex, signs that you're trending towards osteoporosis. So maybe you have a bone density scan and it showed some loss, or you're prone to brittle bones, breakages, or osteoporosis runs in your family. Estrogen deficiency, which is actually a decrease in estrogen before perimenopause, as in primary ovarian insufficiency or loss of ovarian function before 40, can happen in women genetically, a low percentage of women, but also if you've been really sick, or early menopause, as in women who stop having periods before age 45, or who have their who had their ovaries surgically removed before 45. Okay, so hope that's clear on the when. The second part of the question, are there risks and who should avoid hormone replacement? So this is a great question. It's probably going to come up with your doctor because there's a lot of debate around this. And sadly, the whole medical paradigm as it is still being taught is based on seriously flawed research from over 20 years ago in 2021 that indicated an increased risk of cancer with estrogen-only therapy. Now, we would not do estrogen-only therapy. So and in the study, they didn't even use bioidentical estrogen in the study. The estrogen that is the same as humans when I say bioidentical. Rather, they gave these women who were all over 60, another problem, a totally different estrogen from pregnant horse urine. Not the same. Terrible science. The study was since retracted. It was found to be totally incorrect, and a lot of data has shown since that HRT is so beneficial on a number of levels. But still, that false belief is held by most doctors today, and except in the functional medicine and naturopathic space. And this really just speaks to the fact that Western medicine is on average 14 to 17 years behind the research, and that's why your doctor may warn you off it. So just be aware of that. We now have excellent research showing that HRT is generally very safe and very protective. It has so many proven health benefits, and we now know that providing bioidentical estrogen and progesterone, so the same as the body produces, actually prevents tumorigenesis or the development of cancerous tumors. It represents a strategy to prevent breast cancer, cardiovascular disease, osteoporosis, dementia, Alzheimer's, diabetes, the list goes on. And of course, as we spoke about, the data consistently show that women on HRT can improve their mood, their skin, hair, nails, their sense of vitality, their sexual function, their muscles, bones, libido, and just hugely improve their overall sense of well-being. Antidepressive, boosting confidence, that kind of thing. So in fact, I'll point out a stat that the risk of all-cause mortality, aka dying of anything, is reduced by 30% on average in women who are on HRT when it is done well. Okay, that's pretty amazing, right? So you can see a lot of benefit there. As to the who should avoid HRT, there's a raging debate among practitioners, but the consensus from the science is that some of the best hormone experts is that basically all women can benefit, but there's a little bit of nuance and certain populations should use caution before starting. It's generally not recommended if you had recent estrogen responsive cancer, such as certain breast cancers or certain uterine cancers. If you have active blood clots, stroke, or heart disease, or undiagnosed vaginal bleeding. You want to get that evaluated first to see why you're bleeding irregularly, as supplemental estrogen might feed a tumor, if that's what is causing the bleeding. However, if you've been clear of those issues for more than 6 months, the latest thinking is that HRT can benefit you and confer protection. So family history of breast cancer or cardiovascular issues is no longer a blanket contraindication. So those are the risk groups. Generally, it's thought that all women can benefit outside of those factors. And for safety's sake, I just want to add a couple of last important notes on what to avoid when it comes to HRT. One, if you're going to do it, it's important to start within 10 years of perimenopause or before age 60 in general to reduce your risk for cancer, which is just very mildly increased if you wait for 10 years or longer. Get regular pelvic exams and mammograms. Two, it's very important to take bioidentical hormones, not synthetic ones like progestin, which is different from progesterone and is in a lot of hormone products like the Mirena, the Depo-Provera, and most birth control pills. Three, while estrogen has classically been the prime hormone in HRT, progesterone should be prescribed alongside it in women who still have a uterus, because excess estrogen can lead to excess growth of the uterine lining, increasing the risk for endometrial cancer, blood clots, stroke, and breast cancer. So if you have a uterus, you always want to take progesterone and estrogen once your estrogen drops later in the game and you're looking to replace it. Four, always monitor how your body is metabolizing the hormones you're taking by doing a comprehensive hormone test like the Dutch after a few months of starting. You want to make sure you're not breaking down those hormones into harmful or cancer-promoting compounds inside your body. And five, it's important to make sure you work with a practitioner who knows what they're doing. HRT done badly can be harmful and can increase your risks. Okay. That was a long answer, but I felt like a lot of you wanted to know about HRT, so that was some of it in a nutshell. Back to you, AJ.
Yeah, we have another HRT question. I think this one's a little easier. Do women need to be on hormone replacement therapy for the rest of their lives, or is it a limited time? How does that look?
For sex hormones, generally, yes. It's not the answer women want to hear, but it makes sense when you think about the fact that we live way longer than nature intended these days. Our ovaries just start to shut down and we no longer have the ability to reproduce the hormones at levels that will keep us healthy.
Yeah. Right, that makes sense. And then another question was, can you comment on the long-term effects of HRT, which I think you touched on a few of them. And what can we expect to change about our treatment later in life? So that kind of ties back into the question we just asked. It's like, okay, yes, we need to stay on it for a long period of time, but how does that change throughout your experience while using it?
Yes, great. You usually don't need to start estrogen until much later in the game when it starts to fall in late perimenopause or into menopause. If you start having hot flashes and dryness, that can be an indicator that your progesterone is, or that your estrogen is falling. So generally, starting with a little progesterone and increasing it with time is often where women start. Some women do great adding a little testosterone and or DHEA as well. These are androgens. They're associated with men, but they're very important for women as well. In fact, women actually have more testosterone than men at certain times of the month. And these do start to fall earlier in life. So the answer really is though that it depends on your unique hormones, how they shift, and your symptoms you're experiencing.
Great, thank you. Okay. And some other questions more related to like lifestyle. So when is the best time to exercise, specifically lifting weights? Cool. What exercises in general are best for perimenopausal women? And then there's some more smaller questions in there, and I can come back to them, Dr. Mary, but there's also a question about intermittent fasting. Is it recommended, and does it interfere with exercise? So it seems like a functional kind of diet and exercise question there.
Beautiful. I love this question. Okay. There's two parts to this question. The first part is one of my favorite things to speak with women of all ages about, and it's has to do with something called cycle syncing. This is a truly life-changing concept that I wish we were taught. I wish I was taught as a prepubescent girl because it's so valuable. And the idea with cycle syncing is that you want to sync your habits with your hormones and what your body wants for you across the different phases of your menstrual cycle. So remember that diagram I showed you of the hormones corresponding to physical changes in your body? That means your body needs different things from you at those different times. So the 4 phases, the menstrual, follicular, ovulatory, and luteal phase, they happen in that order. You can get away with a lot more in the middle 2 phases, the follicular and the ovulatory, than you can in the menstrual and especially the luteal phase. That's the week before your period. During the other 2 weeks, you're more resilient, you have higher energy, sleep better, you generally just feel better, so you can fast more, you can exercise more and more intensely, you can eat less. This is a time if you want to lose weight that you can try to lose weight safely. You can be more social and you can shoulder more stress and just more on your plate in general. However, in your luteal phase and to some degree in your menstrual phase, the opposite is true. You're lower energy. You need more rest, more sleep. You're less social. You're more sensitive to everything and prone to inflammation from stuff like unhealthy food, alcohol, social stress, etc. So this is when you really want to dial things way down and be good to your mind and body. Otherwise, you'll have symptoms like PMS. So especially in that final week of your cycle, the luteal phase leading up to your period, no intense exercise, no fasting, no deprivation of any kind. Whether it's sleep or food or me time, you just need more of those things. Why? Because your body is actually doing something really miraculous. Women tend to get bummed out about this period, but I mean, for me, at least when I realized what my body was doing, I was like, oh, amazing. So in that time, in that week leading up to your period, the endometrial lining, the inner lining of your uterus, it thickens a lot to prepare for the possibility of pregnancy during this week. And that takes a ton of energy. It's like if you had a big wound or you needed to regrow a giant tissue, your body needs more rest and downtime, and you need to increase your caloric intake by 20%, right? Not the time to fast. And the reason you get cravings at this time of the month is that your body is asking for more because it needs it, and we need to listen to those cravings. You're not going to gain weight, unhealthy weight, by increasing your calories during that luteal phase. So you want to up your protein, healthy fats, complex carbs, so your body has the fuel it needs to build that new organ. And if you don't, you send your body into a stress state, and actually you'll end up with terrible cravings, wonky energy, bad mood, and probably actually gain weight due to stress hormones, even though you might be eating less. So anyway, you asked about the best times specifically to lift weights and fast. So the best times are during the follicular and ovulatory phases, roughly the 2 weeks following your bleed week. Right. Okay, so then there was a piece on intermittent fasting in there as well. Is it recommended for perimenopausal women? Absolutely. During the times I just mentioned. But there is one caveat, and this is the second piece to the answer to your overall question about lifestyle for women, especially in perimenopause. Please do not follow the advice for men when it comes to fasting and exercising. Again, that research, the research and all that stuff was done in men, and women need different things. Our bodies respond differently. So regarding fasting, you never want to fast like longer than 16 hours in general for women. Men, the standard is the 16-8 fast. It was all over the internet for a while. That's a little too long for us. It sends us into high cortisol, like stress mode, and we tend to gain a little more belly fat when we have a cortisol high. So that's one of the key things around losing belly fat. Reduce the stress, don't fast too long, all that kind of stuff. About 14 hours, 15 hours is what's recommended by most experts. 12 hours is what works for some women. It just really depends on your body, your activity level, your stress level. And you want to have your eating window earlier in the day. Don't fast all the way till noon and then eat dinner at 7 o'clock and finish at 8. This is bad news for your hormones, your mitochondria, your metabolism. You will gain weight that way. You want your fasting window to be earlier. So that's kind of the piece around fasting. I'm getting long in the tooth, but I'll just say something about the sports, the weight training, because there was another question about that. I'm realizing we are running out of time, but in terms of exercise for women in perimenopause, it becomes so much more important to do strength training. So there were like basically 4 kinds of exercise. We got mobility, strength training, we got high intensity cardio, and more low intensity thing like aerobic exercise, like walking. So after we turn about 35 or 40, it becomes way more important to focus on strength, to dial down the high intensity cardio, because it's not doing as much for you. You can still do some, but certainly it's not the best thing, and it's not going to help you lose weight. And there's debate about how much lower intensity exercise to get, but I think that the more walking, the better. Mobility is super important as well, especially as we get older. The strength piece is huge because we actually lose bone density and muscle mass during perimenopause more than at any other time in our lives, including menopause. Did you catch that? Perimenopause, we lose muscle and bone density rapidly. And then we kind of plateau. So we really need to counter that with strength training to build muscle or keep what you have and to preserve bone density. Because bone is a tissue that's always growing and remodeling our whole lives. It's not static. Most people don't know that. It's really responsive to our lifestyle. The more tension you put on your bones through strength training, the more the muscles pull on the bones as they contract, and the stronger and more resilient the bones get. So especially if you have low bone density or osteoporosis in your family, make sure you're weight training. And I don't mean like the 8 to 10 pound dumbbells. This is a huge mistake I see women making all the time. You want to lift heavy. Keep working to lift as heavy as you can, like 6 to 8 rep max. You won't get bulky. That's not how it works. And women say that to me all the time. I don't want to get bulky. It's actually really hard for women to bulk up. And most women are afraid of that. If you see a bulky woman, she's probably taking some exogenous thing to get her that way. Some women have a larger build, but you won't go beyond a point. Muscle will also help you burn away fat and increase your caloric burn at rest, and it'll improve everything about how you age. So muscle is actually hugely important when it comes to aging well, and there's a lot of research and great media on that right now. Like Andrew Huberman, Peter Attia, Rhonda Patrick, they're putting out lots of info on how muscle is really like the fountain of youth for so many reasons I won't go into here. But as I wrap up this question, I wanted to mention a book by Dr. Stacy Sims. She coined the term "women are not small men." She has lots of online resources on training, especially for women over 40. And there's a woman called Mindy Peltz who wrote a book on fasting for women, which I think is called Fast Like a Girl. So I'll leave that question there. Cool.
Awesome. Thanks, Dr. Mary. I'm going to quickly hand it over to Michelle, but Dr. Mary, thank you so much for your insights. And everybody just hang on for like 2 or 3 more minutes to hear from our CEO here, and then we'll let you go. But we hope you've learned a lot, and we're so glad that you came. Thank you.
Thank you.
Thank you so much. That was amazing. This is actually the second time our teams heard this, and it just gets better and better, actually, Mary. So thank you for that. For people who have a moment to hang out, we would love to gather your feedback. We're going to keep doing these salons. We're so impressed by this turnout. This is fantastic. We definitely want to hear what you liked. If there's stuff you'd like to see more of, we can build that into the plan for our next salon. So thank you so much for joining. I'm loving seeing some of these faces on the screen that I haven't seen in ages. I think you know who you are. We're smiling, and yeah, so super amazing. And Mary, every time I hear from you, I feel like so much of what I thought I knew about my health gets like unraveled and reshaped into a new, like much more grounded, real 2024 narrative. So thanks for bringing us all up to speed. Many of you, when you signed into the intake, said you wanted to hear a bit more about what Maka does. So we will be following up with ways that you can do that. We serve members in a bunch of different ways, but obviously you get a sense of the sort of work we do now, really data-driven, leading edge, and not always exactly what conventional medicine says we should do, and we're okay with that. But we're very happy with the results we're getting with our members now, and really want to spread the word. So I think that is about it. I see some questions in the chat, but other than that, yes, Mary, thank you so much, and wonderful to have you all along this incredible ride. So I guess we'll leave it at that. Bye, everybody. Thank you. Bye.
Bye.
Thanks for
Bye. Thank you.
coming.
Thanks all.
Thank you.